My name is Alyssa Mandis. Today I will be performing a central line dressing change. First, I will start by checking physician's orders. I've washed my hands. I'm going to introduce myself to the patient. I'm going to close the curtains to ensure patient privacy. I'm going to check the patient's identification with 2 forms of ID. I want to check for name and date of birth. I want to explain the procedure to the patient. I want to make sure that they know not to touch the insertion site or any of the equipment that we will be using. I'm going to raise the bed to a comfortable working height. Okay, I'm going to check the insertion site, make sure everything looks good. I'm going to assess the patient for pain. Doesn't complain of any pain, so I'm going to go ahead and open the kit. I'm going to place a bag, this card, of all my equipment on the bed. I'm going to start by pulling away from me. I will apply a mask to the patient. If the patient cannot tolerate a mask, I will turn their head away from the central line. Then I will put a mask on myself. I will put on clean gloves. And then I'm going to remove the old dressing. I want to hold the lines so that they don't pull out. Pull the dressing down and away. Once I remove the old dressing, I want to check the insertion site for any redness, swelling, inflammation, or any drainage. If everything looks good, I'm going to go ahead and remove my non-sterile gloves. And then I will prepare to put on my sterile gloves. Starting with your right hand. Dump that in the garbage. And then I will continue to open the remainder of the sterile field. I want to take the chloroplast wipe, pinch both sides. I'm going to let the pad fill with chloroplast. I will clean the area vigorously in a back and forth motion for 30 seconds. Okay, once it's clean, I'm going to throw that away. I'm going to allow the skin to dry. I'm going to I want to make sure that the skin also air dries. Don't blow on it, don't pat it dry. I will get my new dressing ready. Once the skin is dry, we're going to apply the sterile sterile dressing. We want to make sure that there are no creases or bumps and smooth it out completely. We can remove the outer edges of the dressing. Make sure to press down all the sides to secure the dressing. And then we're going to remove our gloves, remove the mask from the patient, going to remove my own mask. I'm going to place a label with my name, date, and time. I will apply this to the dressing. I will discard of all of my garbage. Throw that away. I'm going to wash my hands. Make sure the patient is comfortable. Cover them up. Lower the bed. And once everything is done, I'm going to document the procedure and findings on that central line dressing.